Welcome to Session Self Tutorials. Hello, fellow therapists. I'm Ian, a practicing psychotherapist, and I use Session Health each day in my own private practice. In this tutorial, I want to take a look at bills, superbills, and basically our billing documents in general, and how to work with them in more detail. On the homepage, you'll see two panels up here for clients' pending bill and open bills. Basically, there's two main statuses for bills where they're pending or open, and then the last status is complete. A pending bill basically means you've provided services for a client, but a bill hasn't been created yet to get paid for those services. Open bills, those are bills that have been created, but there's still a balance on them. So if we look at our pending section, this is where we can just create a bill and get paid for our services. You'll see at the top of the bill, there's billing responsibility, which can be self-pay or insurance. If it's selected as self-pay, the bill is only going to prompt to collect a client payment. If you have it set to insurance, you'll be able to log both client payments and any insurance payments, whether you're using electronic claims or submitting your claims through Alma or Headway or some other service. If you select insurance, you can log the payments that you received from the insurance company. We'll do one of each. So the first one I'm going to do self-pay. You can see this is going to default to the price that we had on the service when we scheduled the appointment. If we just save it as is, we can apply a payment toward it. We can also add additional products. Some states allow you to charge credit card fees. You have to know what state you're in, or maybe it's some other, maybe you provided a book in session, and so you're going to add $10 for that product, and now the total is $60. You can change when it's due. We're going to press save. So since it was due immediately, it's saying it's past due. There's an identifier, who's paying, the date. And now we can see, here's our line items. This is the service line item. If we need to edit it, we still can. We can change, maybe we actually didn't provide the service. It was supposed to be this one, and we should have charged $100. We can do that. And if we need, maybe it needs the telehealth modifier, we can put that on there. So now we're going to add a payment. There's these multiple options. If you're using online payments, which means you're going to collect a credit card through the Stripe integration that we have, you would keep this checked. Otherwise, if it's a credit card payment, but you're doing it outside of Sessions Health, you can uncheck this box just to log the payment amount to keep track of your accounting. We're going to go ahead and do it as an online payment. The other options you can see, you can log cash check. If the client has a credit, you can apply that, or other. If there isn't a card on file, you can put a card on file if you happen to have access to it, and we'll do that in this case. We can just click the button, and this is just a test credit card that we're putting in there, so it's not a real credit card. Now we can save that card. You probably already have a card on file for your clients, but now we can just add the payment. You can put any notes in here if you need to. So now we can see the status is paid. That bill is now going to show up under complete bills. Refunds. If you need to refund a online payment or any payment really, you click the three dot menu on the line item for the payment and click refund. So this is going to put the payment back on the client's credit card. That might take 5 to 10 days for that to show up. We can go ahead and do that. If you need to cancel a bill for any reason, you can do that from the three dot menu. That's going to delete this bill completely. You can only cancel bills that have had all of the payments refunded. So that's the first thing that you have to do if you need to cancel a bill is refund all the payments. We can look at the PDF of this bill. We can continue to edit the bill. Sharing the bill, if we click that, it's going to email the client with the bill as an attachment. They can pay that online without using the client portal. There's a code that's going to be on the invoice so that they can just pay that bill without logging in. In the email, there's also going to be a link to where they can log in to the client portal and pay using a credit card that they have on file, or they can put a credit card on file after logging in. But there's two options to make it convenient for your clients. So one requires logging in, one doesn't require logging in. And we can share that with them. You can see it lets you know that was sent. Creating a super bill. If the client wants reimbursement from their insurance company, we can create a super bill from this bill and send that to them. We can do it from the bill, but I also want to show you a common way with working with bills and super bills is from the billing tab on a client's record. There's this documents tab. You can filter the billing documents, bills. You can by open, by completed, super bills, claims. If we click new, we can just click new super bill. And if there's not enough information for the super bill, it's going to ask you for that information, and it's going to ask you to make sure that you set this person up completely. And once that's done, you're going to be able to come back here and create the super bill. It's going to show you all the eligible services to be included on a super bill. Now, what does that mean, eligible services? Since super bills are sent to insurance companies to get reimbursement, there has to be an eligible service or a service with a CPT code, because insurance companies aren't going to reimburse you for something that doesn't have a AMA CPT code on it. So any appointments that you schedule, you want to make sure that you have a CPT code on that appointment if you want your clients to be able to give super bills to the insurance company. When you click new super bill, it's going to show you a list of all of the services that haven't yet been put on a super bill. You can include a signature line if you want that person to sign it. Include signature means you're signing it. We're going to create that super bill. We can see here it is. We still haven't shared it. If we need to edit the super bill, we can do it from here. For example, you can see there wasn't a diagnosis that we had given when we did this session, and a super bill needs a diagnosis. So we still have the opportunity here to add diagnosis. We're going to save that. So now we have a diagnosis on our super bill. There's the amount, there's the service. We've signed it. When it gets sent to the client, it's also going to prompt for them to sign it. We can download it as a PDF if we want to give it to them another way, like send it in the mail, print it, or we can click this button to share it through the client portal. So let's do that. And now we can see it's been shared. And now any documents that we've created, bills, super bills, claims, otherwise, they're going to show up here. So we also wanted to take a look at insurance bills. So let's take a peek at those. If we go back to our home screen, we can see here's some pending bills. Let's change this to insurance. So let's assume that we got an insurance policy for this person, and now all of these sessions that we did, we want to submit to insurance. Maybe we don't need to collect a copay yet. We can leave this as 0, and we're going to click save. So now we have a bill created, and we're saying we're going to bill insurance this much. Right now, we're saying the client amount is 0. That might change, but when we click add payment, we're going to see now there's 2 options. There's an option for collecting a client payment, or if insurance has reimbursed us, we can log that insurance payment using this. Right now, we don't think that the client owes anything, so when we click this, it's going to say there's actually no client balance on this bill, so there's nothing to collect. But let's add an insurance payment. Let's say we got our EOBs back and we found out the client actually had a $10 copay for the first 3 sessions. And let's say insurance didn't pay anything on this one because the client was responsible for it. When we click the calculator, it's going to calculate the difference between what we billed insurance and what insurance is actually going to pay for these other sessions that say insurance paid $50. So we can log that on each line item. We can see the calculator is doing the calculation for us to tell us the difference between what we billed and what insurance paid us. And we need to do that so that our bill balances to 0. So now we've logged the insurance payment. If we have a check or EFT number, we can put that in there. Any other notes? If we got the EOB as a PDF or something, we can add that as an attachment. Now we can click save. So now actually the client portion, because insurance said, oh, we were actually supposed to collect money from the client for these 3 sessions. Now this bill does have a $30 balance that the client needs to pay. So we can also click add payment. And now when we click client payment, it's going to let us collect against that. Again, maybe the client sent us a check. So we're going to select check, and we can put the check number here, add that payment. Now there's 0 balance and it's paid. We have other tutorials on electronic claims. So you notice I didn't get into electronic claims in this particular tutorial. You can see our tutorials on electronic claims for working with claims and bills in that context. We also have other tutorials on billing setup and setting up billing, and also auto pay. This tutorial showed you how to do everything manually, but we also have an auto pay feature, and you can look at that separately. So this concludes our billing documents tutorial. If you have any questions, you can always reach out to us at support@sessionshealth.com. Oh, wait, surprise. I just thought of one more thing I wanted to show you in this tutorial. Sometimes people, they need to change the billing amount after the bill has been paid. You can do that by going to the appointment, and you can see here there's a 3-dot menu. We're going to come back to that, but I want you to see the bill. This is paid, and the client amount, that's what we just did. They paid $30. But if we come back to here, if we can edit these services for this particular appointment, let's say we actually needed to pay, we needed to charge $110, and the client copay was 30. Now, when we click save and view the bill, we can see that for that appointment, it updated it on the bill. And so now there's actually an additional $30 that we're supposed to collect. And so we can then do that. So if you need to make any changes to the bill, that's where you do it. You come to the calendar, and then where the services are, just click those three dots and you can edit what you charged. If the client overpaid, it'll automatically go back to that bill and say, oh, the client overpaid, and after you change the billed amount here or the copay amount, it'll automatically apply that as client credit. And let's do one more example of that while we're here. So here's the Smith couple. They're self-pay. We're going to create a bill for them. Let's pretend that they have a credit for whatever reason. We can manually apply a credit by going to the billing settings, and we can just give them a credit of $50. Like I said, the system will calculate credits automatically if you edit the billed amount or the copay and the client is overpaid. It'll automatically set that here. But it's easy enough to just manually set it. So now when we go to that bill that we just made for them, we can see they owe $200. But when we click add payment, it's going to prompt you to say, hey, they have $50 in available credit. Do you want to use that first? Yep, we do. So we applied that credit. They still owe $150, so now we can collect that one more additional payment to pay it in full. So that does conclude the billing documents tutorial. And if you have any questions, please reach out to us at support@sessionshealth.com.